Abdominal pain, pain in the lower left abdomen. The abdomen can be separated into 4 quadrants. The lower left quadrant of the abdomen contains the transverse, descending, and sigmoid sections of the colon, part of the small intestine, the ureter of the left kidney, and the iliac fossa, which is part of the hip bone and pelvis. The iliac fossa is a gateway to the reproductive organs in both men and women. Causes of lower left abdomen pain. There are several possible causes of lower left abdomen pain. Some causes are more common and benign, while others can be serious and require medical attention. Common causes of lower left abdomen pain. Diverticulitis. Diverticulitis occurs when diverticula, small pouches, in the intestinal wall become infected and inflamed. Diverticula form in weak areas of the large intestine, which is often referred to as the colon. Diverticula are present in many. As a person ages, the number of diverticula increases, making it more likely that one will tear or swell. As a result, diverticulitis tends to be more common in older adults, although younger people can still develop the condition. Diverticulitis pain tends to increase while a person is eating or shortly after a meal. Diverticulitis classically presents with associated fever, change in bowel habits, sometimes bloody stools, chills, and fairly localized symptoms. Other symptoms can include nausea and lack of appetite. In serious cases, diverticulitis can lead to bleeding, infection, or blockages. Gas. Meteorism. Gas is often trapped in the digestive tract when a person swallows air while eating, as well as through natural digestion processes. Typically, gas is not anything to worry about and will pass through either the rectum or esophagus. Gas that is temporarily trapped in the digestive tract can cause pain and discomfort until it moves out of the system. Gas can be caused by digesting foods that are prone to releasing gas, swallowing air, smoking, chewing gum, overeating, undigested foods, and bacteria. Burping, flatulence, bloating, and pain or discomfort in your abdomen are all symptoms of gas. Indigestion. Indigestion is caused by a buildup of acid after eating. Richer fatty foods, caffeine, sugary drinks, and alcohol can make indigestion worse. For most people, indigestion pain occurs in the upper part of the abdomen. While rare, indigestion can occur in the lower part of the abdomen. Typically, most cases of indigestion are mild. Symptoms of indigestion include a burning sensation, slight pain or discomfort, heartburn, bloating, or gas. Kidney stones. Kidney stones occur when pieces of the hard mineral deposits that build up naturally in the kidney break off and enter your ureter. In addition to abdominal pain, you'll likely notice urinary symptoms such as discomfort, discoloration, a foul smell, or persistent need to empty the bladder. Typical symptoms of kidney stones include abdominal pain, pain when urinating, nausea or vomiting, blood in the urine, fever, and frequent urination. Hernia. A hernia occurs when an organ or other body part pushes through the abdominal wall. The most obvious symptom of a hernia is a bulge or lump in your abdomen that results from an organ pushing through an opening in muscle or other tissues. There are several types of hernia, but the most common one is an inguinal hernia. The intestine or fat pops through the abdominal wall or the groin. Pain may worsen while coughing, laughing, exercising, or straining. Intestinal obstruction. This is a partial or complete physical blockage of your small or large intestine that prevents routine digestion. Common causes include scar tissue resulting from surgery, hernia, and tumors. Symptoms of an intestinal obstruction can include pain, abdominal swelling, and loss of appetite. Complications include a tear in the intestinal wall or infection. Less common causes of abdominal pain in the lower left abdomen. Irritable bowel syndrome, IBS. Irritable bowel syndrome, IBS, is a common disorder that affects the large intestine. The exact cause of IBS is unknown. Many causes have been suggested, but none have been proven to directly lead to IBS. Studies suggest that the colon gets hypersensitive, overreacting to mild stimulation. Instead of slow, rhythmic muscle movements, the bowel muscles spasm. The symptoms of IBS may vary and typically include cramping, abdominal pain, bloating and gas, constipation, diarrhea, or mucus in the stool. You may find some of the symptoms of IBS after going to the toilet and moving your bowels. Inflammatory bowel disease, IBD. Inflammatory bowel disease, IBD, represents a group of intestinal disorders that are characterized by chronic inflammation of the gastrointestinal tract. Prolonged inflammation results in damage to the gastrointestinal tract. The exact cause of IBD is still unknown. IBD may be the result of a defective immune system. In IBD, the immune system responds incorrectly to environmental triggers, which causes inflammation of the gastrointestinal tract. There also appears to be a genetic component. Someone with a family history of IBD is more likely to develop this inappropriate immune response. Types of IBD include ulcerative colitis. This condition involves inflammation and sores, ulcers, along the superficial lining of your large intestine, colon, and rectum. Crohn's disease. This type of IBD is characterized by inflammation of the lining of your digestive tract, which often can involve the deeper layers of the digestive tract. Signs and symptoms that are common to both Crohn's disease and ulcerative colitis include diarrhea, fatigue, abdominal pain and cramping, blood in your stool, reduced appetite, and intended weight loss. Lactose intolerance. Lactose intolerance is an impaired ability to digest lactose, a sugar found in milk and other dairy products. Lactose is normally broken down by an enzyme called lactase, which is produced by cells in the lining of the small intestine. Lactose intolerance in adulthood is caused by reduced production of lactase after infancy. If individuals with lactose intolerance consume lactose-containing dairy products, they may experience abdominal pain, bloating, flatulence, nausea, and diarrhea beginning 30 minutes to 2 hours later. Celiac disease. Celiac disease, also known as celiac sprue or gluten-sensitive enteropathy, is an immune reaction to eating gluten, a protein found in wheat, barley and rye. In celiac disease, the immune response to gluten creates toxins that destroy the villi. Villi are tiny finger-like protrusions inside the small intestines. When the villi become damaged, the body is unable to absorb nutrients from food. This can lead to malnutrition and other serious health complications, including permanent intestinal damage. If you have celiac disease and accidentally eat something with gluten in it, you may have symptoms including abdominal pain, anemia, bloating or a feeling of fullness, constipation, diarrhea, gas, fatty stool, or weight loss. Shingles. Shingles is a painful skin rash. It is also called zoster or herpes zoster. It is caused by the varicella zoster virus. This is the same virus that causes chickenpox. It can appear anywhere on the body, but it typically appears on only one side of the face or body. Shingles triggers a painful rash or small blisters on an area of skin. Some of the most common symptoms of shingles include a constant dull, burning, or gnawing pain, or a sharp, stabbing pain that comes and goes, a skin rash that resembles a chickenpox rash, but only affects certain areas, fluid-filled blisters that develop as part of the rash. Common causes of abdominal pain in the lower left abdomen that only affect women. Menstrual cramps, dysmenorrhea. It occurs when your uterus contracts too strongly during your menstrual cycle. It can press against nearby blood vessels. This briefly cuts off oxygen to the uterus. The lack of oxygen causes pain and cramping in your lower abdomen. You may also have other symptoms, such as lower back pain, nausea, diarrhea, and headaches. Endometriosis. Endometriosis is a disease in which the endometrium, the tissue that lines the inside of the uterus or womb, is present outside of the uterus. Endometriosis most commonly occurs in the lower abdomen or pelvis, but it can appear anywhere in the body. Most women with endometriosis have no symptoms. However, when women do experience signs and symptoms of endometriosis, they may include lower abdominal pain, pain with menstrual periods, pain with sexual intercourse, and difficulty getting pregnant. Ectopic pregnancy. An ectopic pregnancy, also called extrauterine pregnancy, is when a fertilized egg implants outside of the uterus, most commonly in the fallopian tube. The fallopian tube is not made to hold a growing embryo and can't stretch like a uterus. This condition can lead to bleeding in the mother. An ectopic pregnancy is a life-threatening condition that requires emergency treatment. Other symptoms of an ectopic pregnancy include pelvic pain, upset stomach and vomiting, sharp abdominal cramps, pain on one side of your body, and dizziness or weakness. Pelvic inflammatory disease, PID. Pelvic inflammatory disease is an infection of a woman's reproductive organs. It's usually caused by a sexually transmitted infection. PID symptoms may include longer, heavier or more painful periods, pain in your belly, being very tired, fever or chills, bad smelling, vaginal discharge, and pain with sexual intercourse. Ovarian cyst or tumor. Ovarian cysts are closed, sac-like structures within the ovary that are filled with a liquid or semi-solid substance. Ovarian tumor that form in the ovaries are less common than cysts. They can be either cancerous, malignant, or non-cancerous, benign. This group of cancers includes epithelial ovarian, from the cells on the surface of the ovary, fallopian tube, and primary peritoneal cancers. Symptoms of ovarian cysts and tumors may include abdominal pain or tenderness, bloating, dull backache, increase in abdomen size, nausea or vomiting, abnormal menstrual bleeding, difficulty urinating, pain during intercourse or bowel movements, and pressure on the rectum or bladder. Common causes of abdominal pain in the lower left abdomen that only affect men. Inguinal and scrotal hernia. An inguinal hernia occurs when the intestines or fat from the abdomen bulge through the lower abdominal wall into the inguinal canal. It can persist going all the way into the scrotum and the sac surrounding the testicle. Then it's called scrotal hernia. These are most often caused by a weakness in the muscles of the abdominal wall that develops over time, or are due to straining or heavy lifting. Common symptoms include pain when coughing, exercising, or bending over, burning sensations, sharp pain, a heavy or full sensation in the groin, and swelling of the scrotum in men. Testicular torsion. Testicular torsion is the sudden twisting of the spermatic cord within the scrotum. This reduces blood flow to the testicles. If the testicle rotates several times, blood flow can be entirely blocked, causing damage more quickly. Testicular torsion is characterized by sudden onset unilateral testicular pain, which may radiate to the lower abdomen, with nausea and vomiting. Thanks for watching. If you like this video, please comment and share it with your friends. Make sure to subscribe for more.